Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Hey everyone, welcome to the Canine Culture Podcast. This is your host, Brittany, and today we are joined by Dr. Rodrigues. She is the founder of Pawsitive Healing Mobility Center located in Jacksonville, Florida. So thank you so much for joining us.
You're welcome. Thank you.
So tell us a little bit about yourself, kind of how you got into this practice.
So it's an interesting story, but I went to veterinary school at Ross University in St. Kitts in the Caribbean. I did my standard curriculum there, and I was introduced into rehab during my clinical year at Minnesota Veterinary Medicine School. And I remember being so interested in it that when I started practicing out in general practice, I couldn't stop thinking about it. So I started looking into programs and certifications into rehab, and that just dominoed into what I offer now. So now it's, I do rehab, I'm chiropractic, I also do acupuncture, and I've also, I specialize in anything mobility, but I'm also very specialized in geriatric and senior care.
And so let's kind of talk about each part of your practice, and let's start with rehab. So quite a few people don't know that rehab even exists. And I think a lot of traditional vets, you go in, maybe you get a surgery, that's it. And They don't discuss rehab. Whereas with a person, you at least are told, hey, go do PT. So what are you seeing a lot of rehab coming from? Like what types of surgeries and what kind of cases are you seeing for rehab that dogs benefit from?
So anything orthopedic, any orthopedic and neurologic surgeries, I'll see post-op. So I treat strictly orthopedic and neurologic conditions because that's all affects mobility. In terms of where the cases are coming from, a lot of my clients are looking for me themselves. They find me online. Mm-hmm. So they're looking for other options when they're told that there's no other options. But I am seeing an increase in referrals from my colleagues in general practice as well. So the more they learn about it and the more they see my patients coming back looking better, then they look into it and they'll refer to me. They're just not aware yet. Mm-hmm. But it's definitely growing. It's a growing discipline, rehab. And the more we can show how beneficial it is to our patients, I'm hoping in the next 5 years we'll see even more growth because it really is such a critical part of recovery, not just for post-op, but again, our seniors and geriatrics, because that's when people really don't think about rehab. Mm-hmm. You know, they always think it has to be a certain injury or some sort of trauma. And I see all sorts of ages. You know, my young guys, cruciate ligament tears are very common, so I see those guys post-op. I see a lot of disc disease in the neurologic world. But no one really thinks about doing this for pain management and quality of life management for seniors and geriatrics. So that's why I've really become interested in it, because not many people are doing it. And I just love my seniors and geriatrics, and they need more options because we can really get a few years out of them with good quality of life with what I offer.
If someone has a senior dog and maybe they fall into that boat of, well, I don't need rehab, they didn't have surgery. When do you think is a indicative time for them to start looking into rehab or just overall pain management, even if they don't know if their dog is in pain per se? But what are the signs for that?
So when they start slowing down, because we know these guys age quickly, right? I mean, 6 or 7 years old, they're already considered seniors. So usually that's about when we start seeing them slowing down just a little bit. They may take a little bit longer to get up. They may just not be going on long enough walks like they used to before. So any of those changes, they're still doing okay. But anytime those small changes, that can be a sign of arthritis, which is the most common disease that we treat in seniors and geriatrics, muscle loss, things like that. But that's a little bit more visible. But anytime if they look stiffer or if they're just not moving as well as they used to, that's when we should start assessing to see where are we at, what do we need to do, and what does this look like in the long run.
Mm-hmm. And so let's talk about the different modalities that you employ in your practice. So one of them being hydrotherapy.
Yes.
And I don't think a lot of people have seen it unless they have had a dog come to you or one of the very limited practitioners in Jacksonville and quite frankly, most cities. So talk to us about hydrotherapy and the benefits.
So hydrotherapy is amazing in that we use water as one of our tools to get these guys to move better. So it gives us everything we're looking for in terms of improved mobility. So increased range of motion. So that's how much and how well the joints can move. It strengthens, which is huge for all my patients. So whether we're looking to increase muscle mass or just improve stiffness, that's all going to be treated with hydrotherapy. So the water gives that buoyancy or support to the body. So when I have it at a higher level near the hip, it actually takes 80% off of their body weight off of there. So they feel very floaty and light, just like water aerobics.
Yeah.
And then when you add a treadmill and I'm controlling their speed and duration, they can move much better underwater than they do on land. And the more we do that, we're actually translating what they're doing in water onto land. And it's amazing the difference you can see in any of my patients. And I can see some pretty critical patients. They don't come in walking, but they'll walk out. So it makes a really huge difference.
And then what about acupuncture? And anyone that's listened to my podcast for a while, I've probably talked about acupuncture twice every season because I believe so strongly in it. And when I first found acupuncture for dogs in 2016, I thought it was so woo-woo. I thought it was so ridiculous. But time and time again, I was proven wrong. I would go in almost testing them. My dog's not eating. They would do a few spots. She'd come home and eat. My dog's not sleeping. Do a few spots. She'd come home and sleep. And it was insane, to the point where I was like, this is undeniable. There's no question that acupuncture works for dogs. At least I don't even get acupuncture because I don't want to pay for it for me, but you better believe all my dogs do it. So tell us a little bit about some of the benefits of acupuncture that you see in your practice.
Yeah, acupuncture is pretty magical. It is Chinese medicine, so it's a little more complicated to explain, but it helps. So it's a big pain management factor. Okay, it helps with pain. It helps with a lot of neurologic conditions. So it helps to wake up the nervous system, is what I say. So when these guys are not walking and they're paralyzed, acupuncture is one of my biggest tools to get those legs to wake up again. So what it's doing is anytime we insert a needle into certain acupuncture points, and there's many around the body, which is what we study as acupuncturists, in very simple terms, what we're doing is we're opening up that pathway so that qi in Chinese medicine is the life energy is flowing through better. So because that qi is flowing through better, healing is going to that particular area. So what we find is that they feel much better, whether it's pain or what we call an obstruction of qi flow in Chinese medicine. It does so well with all the modalities that I offer. So when I combine them, the results are just amazing. Even when I have cases where I think, gosh, I'm not even sure if I can turn these guys around. It's a miraculous what we can see with acupuncture.
Yeah, I would argue it might be more beneficial, or there might be more of a I don't know how to put this, but more of an effect, more of a tangible effect when you do it with dogs versus humans. And it's crazy to me how well it works.
And what I see in my theory in human versus dogs, obviously I treat dogs and I see the result, but they don't have that placebo effect, right? So they don't have that mentality or that mental factoring in. They're not thinking about what's going on. They don't even know what's going on. Right. So that's the purest healing you can see, where people, we can get in our own way, right? We can get in the way of our own healing. If you don't believe in it, it's not going to work. Yeah. So our minds are a big part of our wellness. And if we don't believe it's going to work, then it's not going to work. I have plenty of clients who have said, I've had acupuncture myself and it hasn't worked.
Yeah.
And I said, well, I could only, go off of my patient, and they see it. So they believe it in their dogs, but in themselves, they can't get it to work. And it's because they just, I think it's just a mental blockage.
Yeah.
But in my patients and dogs, it's just proof. It's more proof that it works.
Do you think acupuncture is beneficial? Let's say someone was on a really tight budget. They only wanted to come once a quarter or once every 2 months. Do you think there's still benefit in that? I know, regular acupuncture is better than spreading it out. But for those that are kind of being more cost conscientious, what is your thoughts on like a quarterly maintenance acupuncture?
I always say, I mean, it is ideal to do it more regularly, but I always say with any of the modalities, something is better than nothing.
Right.
Because it is so good. You know, it's not going to hurt them.
Mm-hmm.
So if it's not going to hurt them when we can manage once a quarter or however it is, then let's do it and see what comes of it. The alternative is if we're not treating. And then, you know, depending on what the case is, that may be much worse.
Mm-hmm. And then another modality that I see commonly used, and you do it as well, is the laser therapy. And there's so many different lasers. So tell us about the laser that you use and the benefits of that laser.
Yeah, so laser is also another amazing modality. The one I use is the cutting edge class 4 laser, and it's a very powerful laser. And it's what we call photobiomodulation, and it's just a fancy word for photons penetrating into the tissues at the cellular level. Again, it's a lot more complicated, but what it's doing essentially in general terms is it's removing inflammatory cells or the bad cells that we don't want, relieving pain at the same time, and it's bringing healing cells in for all sorts of level of tissue. So tissue can be bone. A bone is tissue, believe it or not, that we don't think of it as a tissue, but ligament, tendon, muscle is tissue, spinal cord. So skin is very responsive to laser treatment. For example, if there's a wound, if there's a laceration, an incision, it helps at any of those levels of inflammation. And it really does a great job because 99%, if not 100% of my patients that come in have some sort of pain or discomfort. That's why they're coming in, whether it's post-operative pain or pre-operative pain or, again, senior-related. And the laser helps to really relieve that pain because once we can get the pain under control, then we can strengthen them and help their range of motion, help them move better. But you can't expect these guys to move better without relieving their discomfort first.
Right. Yeah, we had a vet who started using laser after our dogs got their dentals.
Yes.
And it actually made a pretty drastic impact in how quickly they were kind of back up and running and back up to normal. I mean, we're talking next day, totally fine, even after extractions. So.
Even post-op, like spays and neuters, incisions, vets who are using it for that helps recovering much better. It's just amazing. It's an amazing tool.
Yeah. Now, we talked a little bit about aging, which you can't prevent, different things that maybe are not preventative as well. Maybe your dog is predisposed to a particular issue. But is there a common injury or issue you see that could be alleviated by owners? Like, is there something that a lot of dog owners do that if you could tell them, like, please don't do this or please stop doing this? Is there anything that comes to mind for you?
No, not specifically. So much doing something. What comes to mind is, and this may be a little different from what you're asking, but what comes to mind is the mentality, and I'm going back to seniors and geriatrics, that, you know, they're just old. There's nothing else we can do.
Right.
Or if we go through all the regimen of drugs, right, medications, and they don't work, then there's nothing else. And I do practice, I'm integrative, so I do medications and alternative medicine, but they're not the only option.
Right.
So that mentality of, well, they're 14, so people can't believe how well they can do for another year or two with additional care. It's just a matter of doing it and looking for it. So it's the people who are seeking for more help that are able to see that in their pets. But of course, if you think, well, they're old and that's it, you know, age is not a disease. It's a factor, but I say it all the time, age is not a disease. So seniors and geriatrics deserve more care. And there's definitely a lot of options out there. You just need to find the right veterinarian that can give you those options.
So if people are located in the Jacksonville, Florida area, where can they find you, your, website, social media, all of that?
So website is www.positivehealingvet.com. Facebook I'm on is Positive Healing Mobility Center. And then Instagram is positive_healing_vet.
And Pawsitive is PAW.
Correct.
So throw the paw in there like a dog paw.
Yeah.
Well, thank you so much for sharing all of this information. We really appreciate it.
Oh, you're welcome. Thank you so much for your time.
Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, If you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.